Rita, would you like to say a few words about the emergency department now and what you're hoping for?
I think it's right that a bigger emergency room and taking into account all of the ideas expressed, but I would go one step further and say that many times aging adults come to the emergency room is because of escalation of symptoms that has not been addressed immediately. So communication with the primary care team becomes a big issue, and certain things can be treated in the primary care clinic area rather than having to have a patient come in and stay for long hours and get, multiple testing done all over again. So again, we are talking about the communication, but today, me and my team, we spend many hours in the emergency room. And what typically happens is, of course, space is an issue, but trying to analyze what needs to happen right away. And I think what Dr. Tingwal said, the access, the immediate access in terms of going into radiology, the reports being read, what's going on, people paying attention to that. So it's really, once again, a big picture. If you investigate why your loved one comes to the emergency room so many times, you'll see some of the questions that we are trying to raise, and we are trying to look at that.
Another benefit of having a larger emergency department will mean less waiting time for a bed in the hospital for patients who need to be admitted. So we have a situation right now where if the hospital is full, as it frequently is, and people come into the emergency department, and because we're a level 1 trauma center, a higher percentage of our patients who come in for emergency treatment do need to be admitted than would be the case for a community hospital. So if the hospital's full, then that means that people either have to wait a very long time in the emergency department, or at a certain point, the emergency department reaches beyond its capacity, and then we have to start sending ambulances to other hospitals that may be farther away and which don't have the level of care that we have available here at Stanford. So as we look to the specific features to make the emergency department more effective and more comfortable place to be, the capacity issue alone is a very significant one for us. Why don't we take just 2 or 3 more questions, and then I think our speakers will be happy to stay after for a few minutes and talk to anyone one-on-one whose question we were not able to get to. So this gentleman back here.
Yes, I'd like to ask a question about external design. 1,000 square feet is going to intercept a lot of the rainwater, especially in a heavy rain. What are you going to do with that rainwater? You have any plans about that?
It's being addressed in the design of the building. We are designing a building to meet current and hopefully future green design initiatives. One of the reasons for the 3rd floor roof garden is to actually capture a lot of that rainwater in our roof element rather than to have to deal with that further downstream. And there'll be many other mechanisms that deal with reuse and capturing of rainwater. I would say, however, that one thing we have to be careful about is the balance between what we can do in a sustainable facility versus what we have to do that is specific to a healthcare environment. We have very complex code issues in the state of California of what we can do and what we can't do with certain things, such as potentially a gray water issue, et cetera. We are not allowed to reuse certain types of water recycled back into the hospital for potential infection control issues, et cetera. So we have a more limited palette of things we can do in a hospital than we could do in a home or an office environment. But we'll be doing everything that we can to respond to reuse and sustainable issues.
Is that the creek is just has very limited capacity, and because Stanford Shopping Center here has paved all the parking and so forth, and the ground does not absorb the water, so it goes down and it just floods everything on the east side of Palo Alto, the one that's next to the creeks. And I think one of the things that people have suggested is that you might put reservoirs below the parking lots near El Camino and let that fill up and then release the water back into the creek gradually. That would be the neighborly thing to do, I think.
So thank you for that comment. Maybe this would be a good time to just update everyone on the fact that there is an environmental impact report being produced right now for the entire medical center renewal project, and we're expecting a draft of that report, which will cover a very wide range of issues, to be made public later this spring. So maybe one more question, this
think we
gentleman.
have
I'm sorry, I
somebody.
can't. The light's right in my eyes. I think this lady in the aisle right here.
Hi. Thank you very much for this presentation. It's pretty exciting to see some of the changes that you're proposing. One thing I wanted to emphasize, and somebody else mentioned hospital-acquired infections. My husband was hospitalized at Stanford, and we did find occasionally that there was not washing between patients, and he did get a hospital-acquired infection. So I guess my request would be to really make sure that those protocols are followed.
You might be interested to know that in addition to other things that we're working on for the future, that even today we have safety improvement and what they call quality initiatives that are actually going on in the hospital today. And things such as you mentioned that relate to hand washing and other measures to improve safety and security are happening today. So as much as we have these wonderful plans and opportunities in the design of the new facility to actually create a facility that will be that will improve safety, we take safety very seriously, and those are things that we are working on currently. So I want to thank you all again for coming. Before we wrap up, I should just also mention, Dr. Tingwall pointed out on the site plan that another very, very important part of the renewal project is the expansion of Lucile Packard Children's Hospital. And at a future program, we hope to be able to have the opportunity to share more about the plans for pediatric services. But a key point for all of us to understand in our community is that the Children's Hospital today does not have adequate capacity to meet our community's needs. And it's a very difficult thing for our physicians at the Children's Hospital to have to tell a parent of a sick child in Palo Alto that there's no bed available for that child, even though we have one of the leading pediatric institutions in the country at our doorstep. So we look forward to be able to share those plans with you. At the back table of the room tonight, there is information available about the renewal project, and our community outreach coordinator, Kay Wilson, is here along with other members of our team to be able to answer any other questions you have. So thanks again to Avenidas, thanks to all of you, and we look forward to seeing you again.